How do informed consent laws vary for plastic surgery? Imagine planning a trip without knowing the destination or the potential risks involved. That's why informed consent is so crucial in plastic surgery. It's about making sure patients understand what they're signing up for. But laws about how this is done can differ a lot from one country to another. These differences reflected how each place values patient rights, safety, and cultural attitudes toward medical decision-making. In the United Kingdom, the law requires that the surgeon personally explains and documents the consent process. The surgeon must ensure the patient truly understands the procedure, including its risks, benefits, and limits. The UK emphasizes a patient-centered approach, meaning patients are encouraged to take their time, reflected, and ask questions before deciding. If a patient cannot make decisions on their own, legal frameworks like the Mental Capacity Act guide the process, always aiming to protect their autonomy and best interests. Surgeons must also include details about costs and alternative options, including the choice to not have surgery at all. Across the Atlantic, the United States has shifted from an older standard that focused on what doctors thought was necessary to a more patient-focused approach. Now, the law says that what a reasonable patient would want to know is what matters most. This means doctors must disclose all material risks that a typical patient would consider important. If they fail to do so, they could be held liable. Some states also extend their duty of disclosure to physicians who refer patients for surgery, especially if they have control over the treatment plan. In countries like Australia, Canada, and New Zealand, the trend is similar. They follow the patient-centered standard, requiring doctors to disclose risks that a reasonable patient would want to know. These countries also emphasize thorough documentation and ensuring patients understand what's involved. Courts in these regions have supported the idea that respecting patient autonomy is essential in the consent process. But not all countries follow the same rules. For example, in Singapore, the law still relies on a professional standard, meaning the adequacy of disclosure is judged by what a reasonable doctor would say. Brazil, on the other hand, generally follows the patient standard, focusing on what the patient needs to know. Iran requires written consent before cosmetic procedures, but this doesn't replace detailed discussions about risks, benefits, and options. No matter where you are, simply having a patient sign a form isn't enough. Ethical practice means having a real, detailed conversation led by the surgeon. This discussion should cover possible complications, realistic outcomes, alternatives, and costs. Patients should have plenty of time to think about everything and ask questions. For patients who can't make decisions, legal guardians or family members step in to help ensure the patient's rights are protected. In some regions, advertising rules also play a role. For example, in the European Union and Germany, marketing materials must be accurate and include risk information. This helps set realistic expectations before the patient even walks into the clinic. Overall, while the core idea of informed consent is universal, the way it's implemented varies. The global trend is toward a patient-centered approach that emphasizes full disclosure, understanding, and respecting individual choices. Surgeons need to follow both local laws and ethical standards, making sure patients are truly informed and comfortable with their decisions. Remember, always consult a qualified healthcare professional for personalized advice and detailed information tailored to your specific situation.